How much bleeding is too much bleeding to have with your cycle, your bad cycle, whatever's going on? Hi, I'm your local OBGYN. I love women and let's talk about it. So, as a provider, it's really difficult to quantify on the phone or in a discussion with a woman without sort of having the same language that we're speaking. How much bleeding is too much bleeding? When do you need to be seen in an emergency room? And when can you just sort of like manage this on your own? And I think that there's some things that you have to understand. Like, you're not sitting there with a cup and a measuring spoon or whatever to figure out like how much is coming out to then give us a numerical estimate. So, what are you supposed to communicate? I think that what we as women's care providers need to know is okay, what are you using to collect your bleeding? Is it a tampon, a pad, a liner? And if you're using those products, is it like the super flimsy light one or the small tampon? Or are you using like the big mamas? And you know what those big mamas are. And it could be in pad form where you feel like, you're waddling around. It's so big because it's like a diaper, or it could be the super duper duper extra tampon. But what's actually going to be helpful is, how many of them are you using? I have some women that are using 2 tampons at a time and it's still not functional, or they are literally wearing a super diaper with an extra thick pad. So those bits of information are super important for us, in addition to the fact to how frequently do you change them? Are you changing them every half hour, every hour, hourly? And when you do so, is it saturated, or do you just not like the feeling of it being sort of unclean and you want to change it earlier? So maybe it's not saturated, maybe it just has a little bit going on with it. And then in addition, do you have clots? And clots are those jello-like things that can come out of your vagina. It's congealed and sort of clotted blood. And I always like people to describe their clots to me in the form of fruit, because we all kind of speak the same language when it comes to the size of different fruit. How long has your bleeding been going on? The number of days. How many of those days has it been particularly heavy? And then, are you having any other symptoms? Dizziness, lightheadedness, heart palpitations. All of that will get you and your doc the right information to decide, is it time to get your butt in the office or the emergency room?